Tanisha here. So today is Wednesday once again, and I want to introduce to you guys my new video. Today I'm going to be talking about the pros and cons of being a surgical tech. I'm going to list 3 of each, and please comment below if you would like to hear more of my opinion. Okay, the pros. The number one thing I listed was surgical engagement, being able to assist and be a part of surgery. I think that's the most exciting thing for me, because even as a young kid I've always been interested in surgery. I knew nobody in healthcare, let alone surgery. So for me, it was always something that was very exciting for me personally, and that's always something that keeps me going as far as work. The second I listed is helping patients in surgical treatment. If you're serious about healthcare, which you should be if you're interested in becoming someone in the healthcare profession, I think your patients should definitely be the reason why you're going into this business. And number 3, I put the ability to travel. You guys know from watching some of my previous videos that I am a traveler surgical tech, and that has been like the most exciting part of my career, and I'll do more videos on those later if you guys have questions about that. I'm just going over questions that you guys have asked me as of lately. The cons, the 3 that I've listed, are there's not a lot of options as far as jobs. For number 1, like for nurses, you can work in a healthcare setting, you can teach, you can do home health aid and things like that. It's a little bit different for us. We're kind of just stuck inside of surgical settings, whether that's outpatient or hospital or a dentist's office, a veterinary office. We have options, but it's not as much as, say, if you were a nurse. So that would be one of the cons. Number 2, the pay is not as high in some areas. If you are, in a certain area, depending on the cost of living, the pay can be extremely low. And if you are living like in a major city, the pay can sometimes be high, but that's not always the case. So like for nurses, I know they get paid a certain amount pretty much across the board, and for us it kind of fluctuates depending on the city and state that you're in. And number 3, which should be my number 1 reason, number 1 con, is risk of infection. We are on the front line of getting poked with needles, blades, getting hit with an instrument that's really sharp, and it's just that little prick can really, the little prick from an instrument or something like that can really, damage our health and cause us to have diseases and things like that. So my 3 cons and pros, to go over them again, my 3 pros were surgical engagement, helping patients in surgical treatment, and the ability to travel. And my cons were there's not a lot of options as far as jobs. The pay is not as great in some areas, and risk of infections with needles or blades or sharp instruments. Thank you guys for watching. Please tune in. Please be sure to like, subscribe, and comment for more videos. Thank you. Bye.